Okay, so while we're waiting for some questions, waiting for questions, I think we can continue to talk about some of the problems that we have seen in the clinic. Now, it's important, for instance, for a woman to know that by the time you get to the age of 40, your your reproductive potential, your ability to reproduce will go down sharply. So your ability to produce healthy eggs that can result in healthy babies will be reduced. So if you are there, the break in transmission. Um, I was talking about age and fertility as far as women are concerned. So I was going to say that women's reproductive system is different from that of men, whereas a man, as long as he is healthy and alive, even at the age of 100, will be able to produce viable spermatozoa to fertilize the woman. But for women at certain age, they become unable to be reproductively viable in terms of achieving conception. So because of that, our women need to be more conscious to know that as far as making babies are concerned, there is a limit, age limit, for that. There's a certain age that if a woman gets to, no matter how fresh and young she is looking, she won't be able to make babies. You may improve your body and look very healthy and look like 16, but the organs inside your body are still as good as they are supposed to be. So it's important to know so that you can take advantage. Besides, it's not even too healthy to be having pregnancy at late age. So there are a lot of medical conditions that get superimposed with pregnancy when you start making babies at the extreme ages, from late 30s to 40s. Hypertension, diabetes, and all other medical conditions, they also come in. So it's the earlier you make your babies, the better. The better. But however, if you have not been able to make your babies and you are at this age, there is a solution for you. So you come around and get evaluated so you can get um, the results that you desire. Now, someone is asking, what is the role of folliculometry in IVF? What is folliculometry? Folliculometry is just the examination of the follicles, the measurement of the follicles, the evaluation of the follicles using ultrasound scan. Okay, so it is very, very important in IVF. And as far as IVF is concerned, you will have to do follicular tracking. That's follicular tracking. It's the same thing. Folliculometry just means that you're measuring the follicles, but you track them. You measure, you do serial follicular tracking. So as you are on your drug, those drugs that we are expecting to be able to help you to produce as many eggs, viable eggs as possible. Okay, as you are on those drugs, we are monitoring how your body is responding, how the eggs are, maturing. Okay, we want to know how is their growth, because at the end of the day, it is the number of and the quality of eggs that you have that will determine how many good embryos you can have. Someone can finish an IVF session and just have one embryo that is viable and good enough for transfer. Okay, so that means that, of course, it limits your chance of having pregnancy. Okay, having pregnancy. So the better the eggs, the better the outcome. So that's what folliculometry is all about. We do a lot of it in IVF. You have to know what you're doing. The reason why folliculometry is important for follicular tracking is that, for instance, you are on a certain dose of drug, and we want your eggs to be growing at a certain range. Okay, and you do a scan, we find out that the eggs are not growing well. So that is how we know that we need to increase the dose of your drugs so the eggs can do better. So sometimes too, when you do follicular tracking, you find that the eggs are even doing far much better than you expect. That you are even overproducing eggs or something, or the maturity is good enough. So sometimes you can reduce the dose. Okay, what we call posting. You can reduce the dose of the drug that the individual is on. That's the importance of the folliculometry. And there's even a way you will do a scan, and at a certain stage, you find out that you haven't even seen any significant improvement in the egg. You can even stop the entire cycle and start again because the person is not doing well. That is the importance of folliculometry in IVF. Someone is also asking if is it limited to timing of ovulation for coitus in in vitro fertilization? No. You know, when you are participating in an IVF cycle, we stop your period. We want to take over, so you no longer depend on your normal period and your ovulation. No, we do what we call down regulation. When we down regulate you, it means we are shutting down the pituitary so that we we can control your cycle. So we are the one, you're not going to be able, the aim of down regulation is to make sure that the eggs that you are producing, you don't spontaneously ovulate them. Because we don't want you to ovulate, we don't want them to rupture, we don't want you to ovulate, we want to harvest those eggs. So that is when we are doing IVF. So there are drugs that will control all this. You cannot have ovulation while you are on IVF cycle. The drugs will make sure that that does not happen. By the way, your whole cycle is taken over with drugs. Because they will first of all do down regulation to shut down your pituitary and make sure you are not on your own producing eggs and ovulating. So it's the drugs that will then direct how the eggs grow, how they mature, and then at the appropriate time, those eggs will be harvested, for fertilization. That's what we call oocyte retrieval. We call it retrieval or egg collection. When they are matured, when they get to a certain stage, we harvest them, bring them out, use embryologists will look at them in the microscope, see those ones that are good, isolate them, and then fertilize them for transfer. So that's what we are talking about. Now, back to what I was saying about the issue of age. I just want to say something that will make it clear for women to understand that when a baby girl is in the womb at about the gestational age of 5 months, that baby girl inside her mother's womb already has all the eggs she will have in her life as a woman. All the eggs are already there. And then you have them around 2 million. By the time that baby girl is born, the number of eggs has now reduced from 2 million to 1 million. Now, by the time that baby girl attains puberty usually ranges from the age of 9 to 13. That is the time when the young girl starts developing breast and then eventually starts having menstruation. So at that point, the egg has further reduced from 1 million to around 450 to 500,000. Now, this remaining 450,000 to 500,000 eggs, every month, that individual will be recruiting 20 to 30 eggs from both ovaries. 20 to 30 eggs begins a journey to mature. They begins a journey in which all of them are competing to be the one or at most 2 eggs that will ovulate at the end of the cycle. So at the end of the day, maybe 1 or 2 will ovulate, and the remaining ones will degenerate. Now, whether or not the woman gets pregnant, you find that if the woman gets pregnant, okay, the other eggs, apart from the one that has ovulated, will degenerate. But if the woman doesn't get pregnant, both the one that ovulated and the ones that didn't get to be the matured one, to be the dominant follicle, all of them will degenerate. And the next month, another 20 to 30 start the competition again. So this is how, now all this 20 to 30 we are talking about is from the available 500,000. And then that is what you see every month, 12 months of the year. And then by the time this individual hits the age of 40, you find out that there's a sharp decline. The number has reduced. Just do the mathematics. If you remove 30 eggs every month and then you multiply it by the 12 months of the year, multiply it by how many years? Someone that started, attained puberty at the age of 10 or 12. Okay, by the time the person will be 30, she would have, ovulated for 30 years. So when you multiply it by this number of eggs, then you now find out what is remaining by the time that individual is 40 years. So they are very few. Apart from that, they are few. They are also poor in quality. Because everything ages with time. Even if you you buy a new phone, don't don't remove it from the pack or remove it from the pack. Keep it on the table. Travel, come back after 40 years. You will find that the phone is no longer the same. The same thing with building. So that is how it is happening with our body as well. So that is why the fertility of women is the way it is. So by the age of 45, we see that a lot of women are already going into menopause. The age range for menopause is between 45 and 55. The median age of menopause is 48 years. So, but several years before then, we find that the woman has just very few follicles remaining. Some of them, no matter how much drug you give them, those follicles will not be able to grow, will not be able to mature. So even if they mature and you harvest them, when you look at them at the microscope, they are just empty follicles, no genetic material inside. And there's no way that kind of follicle can get fertilized to result in a viable, healthy baby. So that is why we ask women to pursue these things on time. That doesn't mean that if you are 40, you don't have a chance. Or if you're 41, 42, 43, you don't have a chance. You do have a chance, but you have to come first to be evaluated. There are tests to carry out to look at what your ovarian reserve looks like. I found women who at the age of 40 have relatively good ovarian reserve. Sometimes when you stimulate, you are still able to get 1, 2, or 3 follicles that are good enough for them to achieve pregnancy of their own. So it's important to come and get checked. I'm going to talk about a little about male infertility. Okay, so you will find that a lot of our men are grappling with the issue of male infertility. I've had to educate the couples that come that currently men contribute equally as much as women contribute to infertility. Okay, so you find young women. I found like several couples. This particular couple, the young man was 29 years and the wife was 26 years. And the man has complete azoospermia, no single sperm, no single spermatozoon in the ejaculate. So this is quite common in our society now. And that, again, has much to do with the way the anatomy of the body of the man is. For the woman, the ovaries are inside the abdomen, inside the pelvis. Okay. The ovaries are inside the pelvis. They are protected inside the bony pelvis. So this bone that is in the pelvis that is looking like a ball, the ovary is inside it, well protected. So it's protected from external temperature, it's protected from harm, from trauma, and a lot of things. This is not the case with the men. For men, the testis is outside the body, and the testis is outside the body, inside the scrotum. Scrotum is just a very thin skin. It doesn't offer any form of protection for the testis, which is the organ that produces the sperm. for the man. And then, of course, you know that the testis is sensitive to temperature. The temperature of the scrotum with the testis inside is supposed to be maintained constantly at the temperature of 1 degree Celsius lower than the temperature of the rest of the body. So anytime you find heat around there, it is having an adverse effect on the ability of the testis to produce good sperm. Either it affects the process itself, or it even affects already produced sperm that are stored in the epididymis. Okay, the heat destroys these sperms. It affects it. So, but you see a lot of men, apart from the fact that they wear very tight undies that cause heat around them. A lot of them, especially the engineers, they work in the rig and in places that are enclosed with hot temperature, sometimes exposed to chemicals and radiation that will, affect them. And then the testis being outside is exposed, very, very prone to, injuries, whether they are chemical, injuries or maybe even the heat. The heat and radiation affect this area. That is one of the commonest factors that you see that cause male infertility. The other thing would be maybe for those who suffer childhood orchitis. Orchitis is inflammation of the testes. Usually it's mumps. Children who, when they were young, or maybe post puberty is usually after puberty. Young boys who suffer mumps after puberty, okay, and the mumps affect their testes. You have what we call mumps orchitis. Okay, it can cause some damage, okay, on the testes that may be reversible. That may affect the ability to produce viable sperm. These are some of the things. So usually we encourage men to wear loose boxers as against wearing very tight pants, because loose boxers help to reduce the heat around that area and make the place, relatively free. Okay, it's better compared to someone who wear, except maybe you are an athlete or somebody, and then you are in the field. During that period, you can wear something tight, but ordinarily you should wear something that is very free. That is for the men. It will help improve, reduce the incidence of male factor infertility. So some other things that will affect male factor infertility, that will cause male factor infertility, would be what we call varicocele. When for one reason or the other the plexus of vein that is around the testis there, get engorged and form varicose. You know what is varicose vein? Means that the vein, the wall of the veins are enlarged, they have lost the elastic tissue and the walls are distended and they become so big. And varicose veins, what they would call that as varicocele. Venous blood contains warm blood, the blood that is coming from the body, that the body has already used and is transferring back to the heart. So this blood is relatively warm. Okay, so it warms the area and causes the same heat effect that we talk about when we are talking about the health of the testes. The temperature should be lower than the temperature of the body. But unfortunately, that is not usually the case. So when you have all these factors heating up that area and affecting the cells. Now the cells, the cells of the seminiferous tubules, which are responsible for producing these spermatozoa, they are rapidly dividing cells. They are vulnerable to, the external factors like temperature, especially temperature. Very, very prone to damage, from temperature and other external factors. So it's important that we maintain the temperature of that area and keep it relatively cold instead of warm. So these are the things that affect male fertility. Some other ones may be those who did surgeries like hernia, maybe where the spermatic cord has been tampered with or something. So, but that's rare. That's very, very rare, because most of the hernias are being done by general surgeons who are specialists. They do the hernia operations and they understand the anatomy of the area, so they are able to preserve the spermatic cord during the process. So the other question here is someone is asking, I've heard about women storing their eggs when they are still young for possible retrieval and fertilization at a later stage. How does this work? Is it advisable? Yes. Usually, we advise for oocyte freezing for especially women, for instance, those who are having cancer and maybe undergoing cancer treatment. If you are going to have a radiation treatment for cancer and you are interested in fertility, it is important to, have your eggs preserved. We call it cryopreservation. It's important to do that so that you can use it at a later time when you have been treated for your cancer and you feel better and you are good enough to embark on pregnancy. So it is advisable. The other people that may have it are maybe those who, for any reason, maybe you want to undergo a surgery. Okay, you have a disease that requires surgery, maybe to take out part of the ovary or something. Or maybe you are younger and you intend to plan your pregnancy at a much later age. Okay, so it is better you preserve your eggs so that you can relax and do whatever you want to do. When you are done, you come back and start having your babies. Okay, but of course it comes at a cost. Okay, so it comes at a cost. If you can afford it, it is advisable to keep your eggs. It is better than maybe using a donor egg much later. Okay, but because with your own egg, you have your genetic material, and you are sure you're making a very significant contribution in terms of genetic contribution to the baby that you're going to have. So it is advisable that you preserve your eggs. I said it earlier. It's not just eggs that you can preserve. You can even preserve embryos. The embryo preservation is cheaper than preservation of the egg because the egg is big and the cytoplasm is very large. So sometimes when you preserve the egg, during thawing, there's what we call thaw. Before the egg is used, it has to be thawed back. It will be frozen. Before it will be used, it will have to be thawed back. So, but during thawing, some of the eggs may not survive the process of thawing. So you may lose some. So it is actually more advisable if you can preserve embryo than eggs. It is cheaper for you and it is even so much better. So that is that. But this is something that when you come, you'll be advised appropriately on what exactly you should do. But preservation of gametes is very, very important and it's something that